Okay. Well, I want to welcome all of you to the webinar on writing successful INSHIP Sea grants. My apologies to what happened on Monday. If you were waiting in the wings on Monday, my computer decided it wanted to do updates. I've now learned you do updates early in the day so you don't have that issue right before a webinar. It was a 40-minute set of updates, so it was pretty painful. Sorry, guys. So my name is Debbie Cornman. If you don't know me, I'm the Associate Director of INCHIP, the Institute for Collaboration on Health Intervention and Policy. We are recording this so that it can be posted on YouTube, and I'll certainly send that link to everyone afterwards. I know there's some people who could make the Monday but couldn't make today's. I'm going to run through a few slides and then have, if you could save questions to the end, that would be great. And I do want to thank Josh Harden for making sure that this is working effectively today and we don't have any glitches. He's our IT director extraordinaire. One other thing is this is focused on faculty funding opportunities. And I noticed some graduate students are signed up for this, which is fine, but I do want you to know that right now we're only offering opportunities for faculty, though certainly grad students could be working on faculty funding opportunities. So graduate students are welcome to attend this, but I want you guys to know that this year currently we're not offering any graduate student seat grants. So what are we going to do in our allotted time? We're going to learn about the internal funding opportunities that we're offering this academic year. We'll talk some about the requirements for seed grant funding through INSHIP, a little bit on what makes a successful application, and then the resources that are available to you at INSHIP. And it's not doing, there we go. So probably most of you know what INSHIP is, but I'll briefly just give you a line or two about it. We're a multidisciplinary, interdisciplinary research institute. We really try to be a one-stop shop for researchers, from the conception of an idea to management of funded grants, so that you can work with us from the very beginning of having an idea for research all the way through to getting your grant and having it managed by our phenomenal grants management team. So we're really trying to support the success of researchers, support their evolution, and to collaborative researchers who do really innovative work that has an impact on public health and well-being. So let's talk some about the INSHIP funding opportunities that we're offering this year, FY22. There's a link and I'm happy to share these slides with you. There's a link to our funding opportunities. I want to talk about why we actually have these Sea Grant competitions. And it's very important if you're thinking about writing a Sea Grant application to keep this in mind when you're preparing your application. Because we offer Sea Grant funding to help researchers get the pilot data they need for external grant applications. And also to build successful interdisciplinary teams that address important public health issues. So that is the purpose of these Sea Grants. And we'll talk a lot more about this in terms of what we're looking for in terms of the Sea Grant applications. I'm having trouble moving my slide. We are offering INCHIP Sea grants for UConn faculty. The deadline, the first deadline for these is December 3rd. So we're having two cycles, one in the fall and one in the spring. We started that last year and found that really successful. We anticipate funding 4 to 5 grants in the area of human health. And I want people to know human health is very broadly defined. So it could be anything from weight management to chronic pain, HIV prevention, substance use, behavioral health, emotional well-being, health disparities, social drivers of health. So it's very broad. And if you have any questions about whether your study idea qualifies for INSHIP seed funding, you can contact either myself, Amy Gorn, who's a director, or Grace Morris, who's the research development specialist. But it needs to be consistent with our mission, which I had up earlier, but the mission's pretty broad. And again, these are seed grants to fund pilot work that'll directly support a future external grant application in the area of human health. It's important that it's in human health. And their seed grants, what we're offering, these particular ones are for faculty at UConn Stores, UConn Health, and the other regional campuses who are INSHIP network members. We've restructured our network so that there are now different levels, different titles depending on what your level of involvement with INSHIP is. If you've already become an affiliate, it's fine. You don't need to sign up again. Depending on your level of involvement, you may become labeled as a network member. But so we're going to post some information, send out some information. But if you're already an affiliate, you're fine. For these seed grants for UConn faculty, we're awarding $15,000 a piece. We anticipate doing, like I said, 4 to 5 seed grants over the course of this academic year. What's really exciting is one of these seed grants is going to be focused, we hope that we will get some applications on racism, health disparities, and health equity research. So we're going to prioritize funding one of those. The other ones can be other areas of health, but we're hoping to see some grant applications in terms of this area of racism and health disparities. And this is right off the website, so you can go look at this. It prioritizes research in the areas of racial health disparities and the specific health-related outcomes of racism. When we talk about health disparities, we're talking about how health status or access to health care or health-related resources differs along lines of race and ethnicity. Research on the health outcomes of racism is research that examines the ways interpersonal, systemic, or ideological forms of racism impact health outcomes. This is not intended for research that treats race solely as a variable or biological or phenotypic attribute with deterministic outcomes. So you can go read about this. This grant application, like the other grants we're talking about, those 4 to 5 that we're going to fund, you have up to 2 years to complete the pilot project. And then the expectation is that you would submit an external grant within a year of completing your pilot project. Though I'm going to spend a fair amount of time on the faculty seed grants, I do want to talk about some of the other funding opportunities we have. We have a grant development summer stipend for new investigators. Now, new investigators, I'll put that in quotes. It's UConn faculty have never been awarded as a principal investigator grant that provides more than $100,000 in total cost per year of external funding. So it doesn't mean that you're new to the university. It's more that you're new to getting a lot of external funding. The awards are up to $2,500 a piece. We anticipate that we'll award up to 10 stipends. Now, what are these for? These are to help you write an external grant application it could start as soon as you get the funding, but it's over the summer of 2022 and submit it no later than August 2022. So this is due soon, but I encourage you to apply if you have a grant, if you're planning to submit an external grant, and it gives you a little bit of extra funding. It's only a 1-page summary of the research project that you need in terms of the actual project. There's some other things like letters of support and whatever, but it's very short application. So I would encourage you to do it. I mean, you have to do a problem statement, project rationale, project objectives or aims, and then impact and innovation. And then the decisions will be made relatively quickly. So I encourage you to do that. There we go. We also have rolling C grants for developing interdisciplinary research teams. This is some funding to help you develop a research team. Again, with the idea of submitting an external grant application. It could be for workshops, a series of meetings to develop a research agenda and identify team leaders. It could be small pilot studies. Perhaps you're trying to establish your team as somebody that can publish together. So, maybe it helps pay for a grad student who does a lit review and helps your team publish in the area. So it's any activity that has a potential to prepare your multidisciplinary team. The people on the team have to come from at least 2 different departments. And again, it's the idea of eventually submitting an external grant. The awards are 500 to 5,000, so depending on what you request. Sorry, this is being very glitchy. We also have a Convergence Awards program, which it was started a couple of years ago and nobody has applied for it. So I think that's interesting, but it is focused on large grants. So the idea is the federal funding agencies are very interested in convergence research, which is interdisciplinary research that addresses some of the critical key problems, often complex, that are facing our society. And so the idea of this is to prepare interdisciplinary teams to be competitive for that funding from NIH, NSF, whatever, other funding agencies. So this program provides support for activities that hopefully will make people successful or more competitive for external funding. The grants are for up to $25,000. They can be used to secure course buyouts for participating faculty, as well as other activities. But again, this is for like large center grants, program project, P awards like P30s, P50s. So I wanted to talk briefly about who's eligible to submit C grants as a PI. It's for people with faculty appointments. They are tenured or tenure track, in residence research faculty, clinical faculty, and research faculty and research scientists. Ineligible faculty are postdocs, lecturers, research assistants, research associates, visiting titles, and adjunct faculty. Graduate students, as I said, are not eligible for this particular funding mechanism. And I'm really sorry to say, and we had a lot of discussion with the administration about this, that UConn faculty who work at Connecticut Children's Medical Center are not eligible to be a PI on these C grants unless they can submit their external grant applications through UConn. And it doesn't have to be UConn Stores, it can be UConn Health or whatever. But so the only options for people who work at Connecticut Children's is to partner with somebody who can be from UConn, who can submit through UConn Stores, UConn Health, and can serve as a PI. So that's unfortunate, but that's the reality of where we're at. And I think I mentioned before, you have to be an INSHIP faculty network member, and that has to be by the time your final proposals, your C grant proposals, are submitted. But if you're an affiliate, you already qualify. In terms of project requirements, I've already said it, the research has to be consistent with INCHIP's mission. We are looking for innovation, is the PI addressing something that's novel and not just an extension of an existing project that is going on, like a supplement to an existing project. They have to be linked to a planned external grant application in the area of human health. And please put some time into thinking about, and we'll talk a little bit more about this, about where you intend to apply, what you intend to apply for. Some of the grant applications we've gotten have been weak because there hasn't been much thought put into that. They just sort of randomly say, a variety of funding mechanisms. So, and we'll talk about why that's important. If a PI's application is not funded, they are permitted to revise and resubmit once. And it doesn't have to be the next funding cycle, but in a future funding cycle. What we're going to add to that is the PI has to write a 1 to 2 page introduction responding to the reviewer's feedback and how they've addressed that feedback. Priority for funding is going to be based on a set of criteria that we list on our website, including scientific merit of the planned external grant application. Okay, so it's not just about the internal C grant, the INSHIP C grant. It's also, what's the next step? That external grant application, that next step is really important. And so that has to be delineated in your grant application. And of course, I've already talked about the extent to which it is novel or innovative, which could be a variety of things. It doesn't have to be intervention research. It can be a new methodology, theory, understudied research area. It's also, we're going to look at the scientific premise and the rigor of the pilot work to be supported by the C grant, how much we think it will make a substantial contribution to the planned external grant application. Composition of the research team will be looked at. Preference is going to be given to interdisciplinary research teams. And then also like the feasibility of the plans to submit an external grant application to external funders within the expected time frame. I should tell you, I'm in charge of the C grant program, and I'm in charge of getting all the reviewers together. We have 3 reviewers per grant application, and these reviewers all have expertise in whatever the relevant research area is. So we don't have reviewers who are not familiar with a particular topic area. And so we often have a lot of reviewers, if you think about it. I've had dozens of reviewers in a particular cycle. So we take this very seriously in terms of the reviews, but there are 3 per grant application. These are some of the requirements that you should know about. We really do expect you to use the C grant funds to obtain pilot data for an external grant application. And then those who, and this has been a little bit of an issue for us, if you're based at UConn, Storrs, Hartford, Avery Point, Stanford, or Waterbury, you're supposed to submit your external grant applications that come out of the C grant through INSHIP. And so it's important that you check with your dean or department head or whatever to make sure you can do that. And we've started asking people to do that when we know typically a particular school or department does not submit through INSHIP. Also, we ask people to provide a brief summary of their progress annually to INSHIP. It's pretty short. Lynn Hendrickson will reach out to you, but for a period of 5 years following receipt of your initial C grant funding, we've realized that we haven't kept up with sort of where the progress goes. So that's why we're asking for 5 years. We tended to stop after the pilot project was done, and then we lost sight of whether they actually got external funding. Also, all research projects that come out of the C grant should acknowledge that they've gotten INSHIP funding support, whether it's a publication, presentation, etc. The wording, I'm not going to read it, but you can find it on our website. So these are the application components. I'm not going to go through all these. I just want to underscore a few of them. This is not a long proposal. This is for the faculty Sea grant. The research plan is no more than 4 pages. There's a cover page, there's an abstract, project summary, that's 1 page. Why I've highlighted certain sections is because, again, this is about not only the pilot project you're doing, but the external grant application, the next step that we want to hear about in your grant application. So the abstract should talk about the concept for the future external grant application and how this proposed Sea grant is going to help the research team develop a more competitive external grant. Okay, so that's really important to talk about the next step, how this Sea grant is helping you get to that bigger project. And then the research plan, your specific aims should not only talk about the proposed pilot project, but also information about the planned future external grant application, right? How is that pilot project, the data that you collect in it, is going to lead, how is it going to lead to a new externally funded research project? And then the research strategy, you provide a brief description of significance innovation approach, like is done in NIH grant applications. And the significance and innovation descriptions should focus on, again, on the larger research questions that you're going to be addressed by the future external grant application. And then the approach should focus on primarily the pilot project that's being funded by the Sea grant. And this is just an example of some specificity of the intention to apply for a certain external funding mechanism once they get their Sea grant funding. So they talk about, they're going to do a R01. It's a particular funding mechanism. The more specific you can be, the better it is. So I'd think that through before writing your Sea grant. So getting back to before you start reading your Sea grant, what's really important here is to think about your program of research, right? Where is your program? Where do you want to go with your program of research? And you can have more than one program of research. I did gender-based violence prevention. I also did HIV work. But so think about how this is helping your program of research progress to the next step. What is the big picture for this Sea grant, and work backwards from there, because that's what you have to argue or make a case for in your Sea grant application, but it's also better for your career to think this through. So this is an example of sort of the progression. What's the next big study in your program of research? What preliminary data do you need to obtain external funding for your big study? Because what most funders want is some preliminary data. It's very hard to get funded without getting some preliminary data. So the Sea grant is an opportunity to get that needed preliminary data. And so when you get that preliminary data, that pilot data, it's like, what data do I need to convince the reviewers that I can carry out the larger study? Okay, so it's very important that your next big study not be your Sea grant. That should not be the endpoint. It should be the way to get preliminary data to get to the next stage, which is the next big study. Okay. So what a Sea grant is for, and I'm just reiterating things I've already said, is to get that preliminary data. It can also be examined feasibility of an approach to be used in a larger study. And feasibility is, you're collecting data showing that this is a feasible study, that you can do it. It can be conducted well. You can recruit the number of people, etc. It also is a way to establish a PI's reputation in a research area, and also to build a record of collaboration among the team. Years ago, I applied for an R21, which is NIH mechanism. And the feedback I got was we were not an established team. We hadn't demonstrated we could work together. We hadn't published together. So Sea Grant is an opportunity to do that if you're not an established team. And again, what a Sea Grant is not for is a standalone study. And we have found that historically in the past, some researchers have used it as a way to get another publication, but it doesn't develop into any external grant application. So we're very focused on using these mechanisms to help you progress in your career, but not just to do Sea Grant after Sea Grant after Sea Grant and never go beyond that. It's also it's not a way to fund a student's research. It's here to fund faculty research. So this is right out of National Institute of Allergy and Infectious Diseases, which is you can look at other institutes and NIH, but they are very specific about saying they want preliminary data that can make, the quotes are there, can make all the difference in terms of getting funded for an external grant. So you need to demonstrate two key factors with your preliminary data that your proposed research is promising and that your ability to carry it out is credible, so it's feasible. If you look farther down, it says it's required, again, we're talking NIH, for investigator-initiated R01s, as well as for several fellowship, cooperative agreement, and program project grants. They said it's not required for smaller grants like R21s, which is developmental grant, or R03, but what most people do who apply for those grants, or you're going to compete against them, is they do provide preliminary data. So you're not going to be competitive if you go onto those grant applications without any preliminary data. So again, you need to think about what's the next fully powered study in your program of research. Okay, and then select the funding mechanism. It doesn't have to be NIH. There are all sorts of funding mechanisms. There are foundation grants, there are CDC grants, et cetera, DOD. That's where I got a lot of my funding. But what is this? Not only, oh, I'm just going to apply for NIH grants, but what specific grant are you going for? Because there are different requirements for these different grants, whether you're doing an R03, R21, et cetera. And then one faculty member I talked to recommended that you think about what are the specific aims for that next study you're going for. And you don't have to submit those aims, but just think it through, because then you can say, all right, what preliminary data do I need in order to obtain external funding for that study? And you can outline that preliminary data. But that next study, that next step in your program research should drive your pilot study and what the goals of your pilot study. If you're not sure how much preliminary data you need, you can come talk to us or talk to other experienced investigators who have done this. I don't know that there's, one answer. It really depends on what you're trying to do and what you're proposing. And sometimes you need to have more than one Sea Grant. You get some, like one pilot project may not be sufficient. But we're here to work with you on that, and we can also find other senior researchers, very experienced researchers, who can also provide information and feedback. These are just some common designs of pilot studies. Pilot studies, you're talking about $15,000 at most from us. They're underpowered to demonstrate efficacy, and I see a lot of pilot projects that propose to do randomized controlled trials. I just don't know how you do randomized controlled trials with $15,000. So, and that's not what NIH expects either, by the way. So this preliminary data is not efficacy data. Some common designs of pilot studies are single-arm trials, where you're looking at the feasibility of the study. You might do a pre and post, but again, not expecting you're going to demonstrate efficacy. If you do double arm randomized feasibility trial, it's not about, again, efficacy. It's examining the feasibility of the control condition and the intervention or comparison group, seeing if all the logistics work out, you're collecting data the way you want, but it's not necessarily, it's not looking for efficacy. Focus groups are another common design of pilot studies, really good for intervention research in particular, where you're getting input and feedback from target audience or the potential interventionists, etc. Usability data, if you have app, website, or digital project, collecting some usability data, and then survey studies or secondary data analyses. So what are you looking for in these pilot projects? Well, one, it could be recruitment. Can you recruit the population, the target population for the pilot and the larger study? Because if you can't demonstrate you can get sufficient numbers, that's a problem, and you're not going to get additional funding. So, and is the sample you recruited representative of your target population? Can you, how effective were you at retaining participants? If you had huge attrition, that's going to be a problem for getting external funding. But the pilot study can help you assess that and what you can do differently to do a better job of retaining participants. And then, of course, it's another feasibility outcome of a pilot project is are the measures. You know, I can't tell you how many times I've seen like these measures that take hours to do, and then the reliability and validity of them is highly questionable. So, it's pilot studies are an opportunity to see whether people will complete the measures, they understand the questions, are they the data, is the data that you're getting what you anticipate it would be, or is it problematic? If you're doing an intervention study, common feasibility outcomes are implementation logistics. Like, were you able to implement the intervention as designed with minimal challenges? Did the implementers deliver the intervention as designed? Treatment fidelity we're looking at, how much contamination occurred, if any, and acceptability. That's a really important one for intervention designs. Did the participants like the intervention? How did the implementers feel about it? Were they successful at it? Was how much of what proportion of the participants stayed in the intervention? There's been a lot of issues with multi-session interventions where there's dropout over time, and that can be highly problematic. So all of these things can be done in a pilot study or some subset of them to demonstrate that this is, a feasible, acceptable program. You can also use your pilot study to demonstrate your partnership with communities, with community organizations or clinical partners. How engaged is the partner in the study? Is there buy-in at all levels? I've had issues in some of the work that I previously did in healthcare settings where we had buy-in at the administrative level, but not at the implementer level, which was a problem. And then you can use that pilot study to look at the barriers that to working with these community partners, and it's not that everything has to go smoothly, but you can propose for your external grant application how you're going to resolve the challenges that you came up with. Or it may be, if things don't go well, you do a second study and show how you've addressed it. And then also, are there potential scalability issues? And funders are going to be really concerned about that. If you do a small pilot study with, 10 people, and then you're proposing to do it with 1,000, they're going to wonder about that. So those are the things you need to think about in terms of what you're proposing to do for your pilot project. So what do we offer in terms of support? And we do provide a fair number of services. For seed grants, we can help you identify potential faculty and community collaborators. I'm the one who works with researchers on finding community collaborators. I can't say I'm always successful. We just were successful with one recently who's applying for a huge grant, so I'm excited about that. But we will also help you with that in terms of seed grants. If you give us enough time, we can get you feedback on your pilot study idea and seed grant application. I've worked with quite a few faculty who did not get funded the first time, and I worked with them and gave them feedback in addition to the reviewer feedback. And you will get written reviewer feedback from the 3 reviewers. We also can help you identify a funding mechanism for your proposed external grant application. And once you are awarded a seed grant, we will assist you with your budget and all purchases, hires, and subcontracts. And research, I'm sorry, I'm getting a tickle in my throat. Research development specialist Grace Morris can help you with a lot of this and building your team. It's actually Lynn Hendrickson who will help you with your grant management, purchase, hires, and subcontracts. So for external grants, we will help you, similar to grants, find external funding mechanisms. We will help you build your team if you're looking for collaborators. Again, we can provide feedback on your grant proposal. And the grants management team, which is fabulous, will assist you with the entire application process, including the budget. They push all the buttons. They help with all the forms. It's fabulous. And then once you're awarded an external grant, the grants management team is going to support you through the entirety of your grant. They'll help you with purchasing, human resources and payroll, subcontracts, travel, progress reports, effort reports, among other things. This is all on our website. We have a new website. You can find it all there. So again, I want to give an opportunity for some questions. I encourage you to join our network if you haven't done so. Again, if you're already an affiliate, you're in the network, so don't worry about that. But once you join our network, then you'll get on the list on our listserv for the weekly digests and announcements about all of our events and funding opportunities. And we do have a lot of research interest groups, which are topical focused health related topics. I'm not going to go through them all. We have 9 of them. You can participate in as many as you want. They're not a heavy drain on your time because most of them just have a couple events a year. So I do want to thank Sherry Pagoda and Molly Waring, who did a similar workshop a year or so ago. I don't remember when it was. And so I borrowed some of the material, a couple of things from their workshop. So I want to thank them because they had some really great stuff in theirs. So I want to open it up to everybody else and see if there are any questions or comments. I went through that pretty fast and I will stop sharing. So are there any, you can unmute yourself and ask a question. Is there anything that people would find helpful that we could provide for in terms of support for seed grants? A quiet group. I know that in the past we have provided some examples of successful seed grants or seed grant applications that have been funded. And I don't know if we have any that are more in tune with the way we've shifted our Sea Grant applications, but I can definitely check on that. No questions? Was that clear? I can't see anyone's face either.
Hi. Yeah, I was just going to ask if there were any successful grants you would be able to share, or
Are you talking about Sea Grants or external grants or both?
both, either or. I'm a
so
postdoc, so likely would be helping a PI with seed grants, but
I know we had both, and then let me see what we have. And I know everybody who is funded, and I can find out whether any of them is willing to share. And I find some faculty are quite generous with sharing it.
yeah, I
So
know sometimes it's, I don't know, a gray area for who wants to share or who doesn't. So if
well,
possible, it's, yeah,
I think it also
ability to share, I guess.
I think it also depends whether, like, if you're in the beginning stages and you have something very innovative that got funded, and it's like, I don't want someone else taking that idea.
Yeah.
I do find when people get funded for their external grants and we're willing to share it,
Yeah.
because they're already implementing it or have implemented. But let me check. I know in the
Okay.
past we had some examples, but I will check to see what we have. And I can, like I said, I can also ask folks who got funded if they are willing to share any. We can remove names and budgets and all that stuff. So
Okay. Yeah, that'd be great. Anything,
sure.
yeah, helpful to have, I guess, not templates, but, something to kind of brainstorm off of, I guess.
Oh yeah, I always think it's good to have examples. I mean,
Yeah.
NIH and always has a lot of examples. And it's very good about how to write specific games, et cetera, et cetera. So I do think examples are helpful. And I think when you're talking about INSHIP, which is a little bit more unique in what we're asking people to do, if we can provide some examples to you, that would be beneficial.
Great, thank you.
Any other questions? Well, if not, I'm not going to keep you here. I want to thank you for participating. Please feel free to reach out with any questions you have. If I can't answer it, someone else can. And again, we can provide you with, feedback on your ideas, on your grant applications, and help you find collaborators if you need collaborators. So we are there for you. We want you to be successful. We're successful and you're successful. So thank you again. And I hope we see some applications from all of you. You have a good weekend. Thank you, everyone.